codes?
Three.
Three. External code, that is what? I don't know.
Sclera.
This is sclera, here it is cornea,
Cornea.
and together
Red.
that is fibrous code. Tunica fibrosa. Tunica fibrosa consists of sclera and cornea. On the border between them, sclera has a thick part, it is limbus sclera, and in place where sclera and cornea attach one to another, we have groove, sulcus sclera. That is external layer. A middle layer is vascular coat, tunica vasculosa. And tunica vasculosa consists of choroidea, then ciliary what? Ciliary body. And ciliary body has ciliary muscle, and iris. That is third part of tunica vasculosa. Choroidea, ciliary body, and iris. And last coat, inner coat, is retina. Some words about ciliary body. We said that ciliary body has muscle, that is musculus ciliaris, and from this muscle, it is circular muscle. From this muscle, thin ligaments goes to lens. Somebody help me take this lens. This is lens. Here it is ciliary muscle, and from muscle start fibrous or tissue fibrous thin ligament, or in Latin it is zonula ciliaris. And if this muscle, ciliary muscle, constrict, what happened with ligament? Thin ligament relaxes, and lens has more convex surface. And in this case, we can see for a short distance. If muscle relaxes, it's expand thin ligament, and lens is more flatter in this case, and we can see in long distance. This process has name accommodation. Do you know?
Yes,
Accommodations. And that is possibility to see for good vision in short and long distance with the help of thin ligament and ciliary muscle. And what else? Look here. This is musculus ciliaris. Here it is lens. That they are thin ligament, zonula ciliaris, and from ciliary body between zonula ciliaris we have processes. Processus ciliaris. Processus ciliaris, a lot of them. Processus ciliaris. These processes supplies very good supplies with blood, a lot of vessels here, and these processes, processus ciliaris, they secrete produced fluid. What is the fluid in eye? Aqueous humor. Humor aquosus. And this humor produced in posterior chamber. Who know what is the posterior chamber of eye? That is space between lens and iris. In posterior chamber, we have humor aquosus, and this humor aquosus through pupil goes to anterior chamber. What is anterior chamber? Space between cornea and iris. And here in anterior chamber we have angle, angulus iridocornealis. This angle, angulus iridocornealis, and in this angle we have Schlemm channel or sinus venosus sclera, that is vein, and the humor aquosus absorbed into this vein and removes from eye with venous blood. That is sinus venosus sclera, that is place where humor aquosus absorbed. And what happened if, for example, in time of inflammation, if humor aquosus will not leaves eye? In this case, increase pressure inside of eye. that is glaucoma. Do you know glaucoma? Glaucoma. That is high level of pressure of humor aquosus in eye. It is, first of all, it is very painful, and second, in this case, retina will atrophy of retina in this case. It is dangerous for eye and very painful. That is ciliary body, ciliary processes which produce humor aquosus. Next, retina. Two parts of retina. Posterior part which has photoreceptors. It is pars optica, that is place of vision, and anterior part where photoreceptors are absent, that is blind part of retina, pars ceca, blind spot, that is this place. It is place where optic nerve comes to the surface of retina, that is blind spot. And this is blind part of retina. It is behind of ciliary body and behind of iris. Here we can see only pigmental cells. This is pars pigmentosa. Pigmental layer we have in whole in the surface of eye. Everywhere we have pigmental layer, pars pigmentosa, but nerval spot of retina only this orange color. That is, it finished at the level of ciliary body, and this place has name ora serrata. That is level where photoreceptors finish, ora serrata. And this nerval spot of retina has name pars nervosa. That is why two parts, pigmental part, pars pigmentosa, and nerval spot, pars nervosa. Nerval spot consists of rods and cones. The same heat is bipolar neurons and ganglionic cells. And now, please give me a piece of paper. I want to... parts of visual analyzer you already know. That is eye. Here it is optic nerve. This is optic nerve, and that is optic chiasma and optic tract. And now, this is retina, and in retina we have photoreceptors, rods and cones. And they are receptors, and the same, they are fast sensory neuron, two in one, a receptor and fast neuron. For example, today you explain interoceptive analyzer. If receptor in urinary bladder, where is fast sensory neuron? You answer today. In spinal ganglion. Yes, you're right. Receptor in bladder, first neuron in spinal ganglion. Yes, and where is second neuron?
Nucleus proprius, gelatinosa, or fasciculus,
nucleus gracilis and
nucleus cuneatus.
But in eye, first neuron, that is rods and
Same
cones, and the
receptor.
same, it is receptor. Second neuron, the same in retina, that is bipolar neuron. That is body, and two processes, peripheral and central. And this is second, bipolar, and third neuron, the same in retina. It is ganglionic cells, and axons of ganglionic cells, that is optic nerve, that is axon of third neuron. In today we said that first neuron for urinary bladder, spinal ganglion, second, for example, nucleus gracilis and cuneatus, and third neuron where?
Lateral nuclei of thalamus.
But in eye, three neurons in retina. And axons of third neuron, that is optic nerve. And you know that from lateral part of retina,
Same
fibers
side.
goes to the same side, and from
medially
part
opposite
goes
sides.
opposite, and heat is the same. This and this. And these fibers through optic tract goes to subcortical centers, and subcortical centers, lateral geniculate body, posterior nuclei of thalamus,
thalamus,
and superior colliculus. And now,
pulvina, नहीं ये तो पेलो
Look here, this is nuclei in superior colliculus, or that is cerebral aqueduct. And who remember what is the name of this tract, which start from superior colliculus and goes to spinal cord?
ना cerebello ना ये तो
Yes,
tectus
tractus tectus
spinalis.
spinalis. It passes through anterior funiculus and finishes in motor
And
nucleus. This is said neuron. Oh, sorry, second neuron. First is nucleus in superior colliculus. Second neuron in motor nucleus of anterior horn. And from here goes to striated muscles. That is protection from strong visual impulses. It already was, yes, in spinal cord. From nucleus, from lateral geniculate body and from posterior nucleus of thalamus, axons goes to posterior crus of internal capsule, that is radiatio optica, and finish,
gyros
yes, it is near of sulcus calcarinus in occipital lobe, that is cortical center. That is why this and this, that is fourth neuron. And it is brain cortex, that is cortical center of visual analyzer. And it is not enough. Near of cerebral aqueduct, we have autonomic nucleus. Have you got a green pen? Green. Thank you. What is the name of this nucleus?
nucleus accessorius.
And some fibers from optic tract finish in nucleus accessorius. And from this nucleus we have ocular motor nerve. Ocular motor nerve. What is the number of ocular motor
3.
nerve? Third cranial nerve. It goes to ganglion
Ciliare,
and from ciliary ganglion,
Sublimus,
nervi ciliaris,
brevis and longus.
And now we speak about
Brevis,
We and
musculosphincter pupillae and ciliaris.
Musculus ciliaris. Now, if you speak about pupil reflex, for example, if we in dark room, pupil dilates, and if we switch on the light a lot of light through wide pupil goes to retina, stimulate rods and cones. They send impulses to bipolar and ganglionic cells. They goes to nucleus accessorius and stimulate this nucleus, and this nucleus send impulses for ganglion ciliare, and from ganglion ciliare goes to musculus sphincter pupillae, and pupil constricts.
Yeah.
Now that is diagram of visual analyzer, and here we show pupil reflex and tractus tectus spinalis. It is present in your textbook, and you need to prepare this diagram next time. What else? Refractory mediums of eye. I think you know that light, when it's come to eye, it should pass through cornea, and then behind of cornea, it is in anterior and posterior chamber we have humor aquosus. Then third refractory medium, that is lens, and behind of lens we have vitreous body, corpus vitreum. And all of these structures, they participate in refraction. Cornea, fluid in anterior and posterior chamber, lens, and vitreal body. What is the most strong refractory medium structure? No, in 2 times higher than lens, that is cornea. The second place in lens, then vitreous body, and humor aquosus on the last place. That is important. For example, do you know what is myopia?
Yeah, myopia, the
That is,
near side.
if good vision is not in retina, but in front of retina. And if we take laser, for example, and burn some layers of cells in cornea, we decrease refractory power of cornea, and we move good vision to retina. That is laser correction of vision. Well, and next moment, that is accessory structures of eye. They are a lot of structures which surround eye and help to perform functions of eye. For example, muscles. How many muscles do you know? Six. 4 rectus and 2 oblique
obliquus.
muscles. What else? Except muscles. What else? Do you know what is conjunctiva?
Yes,
That is
conjunctivitis.
connective tissue which supplies inner surface of eyelids and continues to eye. That is protectory function, nutrition of eye through conjunctiva, because it has a lot of vessels.
Yeah.
And in time of inflammation, conjunctivitis, its vessels dilate and we can see red sclera. That is because conjunctiva is transparent structure, and we can see white vessels if it is in time of inflammatory process. What else? Eyelids with eyelashes and eyebrows. All of them are accessory organs. Lacrimal apparate, which consists of lacrimal gland.
glands.
Where is lacrimal gland in orbita? In which place? Upper lateral wall. And from lacrimal gland, secret of lacrimal gland passes through ductuli excretory, goes to superior fornix of conjunctiva, then passes on anterior surface of eye, goes to medial angle, here it is lacrimal lake. From lacrimal lake, each eyelid, if it is superior eyelid, it is inferior eyelid of the eye, and that is eye. Well, in medial angle we have lacrimal lake, and each eyelid has lacrimal point, punctum lacrimale, and from this point start canaliculi lacrimalis, and this canaliculi opens into lacrimal sac, and from lacrimal sac nasolacrimal duct opens into nasal cavity, into which nasal meatus? Inferior nasal meatus. Cleitis lacrimal ductus nasolacrimalis opens to inferior nasal meatus. All of these structures together, that is lacrimal apparate. What else? Behind of eye we have fat tissue. This fat is also important. What? Sharp, and the same, it occupies space behind of eye. If fat is absent, eye moves back
Backward.
to the orbita, and it will very deep in orbita. It's decreased point of vision. We will see only what is in front from us, and we will not see what is laterally. That is also. And this fat has name. It is corpus adiposum orbita, fat body of the orbita.
Okay.
And eye separates from fat with the help of fascia. This fascia has name Tenon's capsule or vagina bulbi. Vagina bulbi. This fascia surround eye and continues from eye for muscles and supplies muscles. They are fascia of own fascia of each muscle. It is also important because if fascia is absent, in this case, fat fused with eye and impossible to move eye. But now, if fascia separates eye from fat, we can move eye in large degree, and we can move upward, downward, laterally. It is in large degree. If fat fused with eye, it is necessary to move neck. If you want to see laterally or upward or downward, but with the help of this Tenon's capsule, we can move eyes. And muscles moves eyes up or downward laterally. So. They are accessory organs. And now we try to cut. Who want to cut?
I.
Please. Take this one. What we will do? Insert it inside of eye and cut cornea from eye. This is eye of cow. Do you know cow? Yes. Please. I recommend you to put it here and insert with the power. It is not so easy. Insert it into.
A kapu important nothing. Not important.
Yes, and now continues. I help you with my forceps. Wait. Yes, continues. And carefully not cut your fingers.